Welcome everyone to Queensland Public Trustees Matters of Trust Forum. My name's Angela Backer and I'm the Principal Communication and Engagement Officer at the Queensland Public Trustee. Thank you all for being here today. We're really excited to be able to hold this forum to discuss key services, avenues for support and ways we can work together. I'd like to begin by respectfully acknowledging the traditional owners of the lands and seas on which we meet today and elders both past and present. I myself are in Brisbane on the Turrbal and Yagara people's land. I recognise those whose ongoing effort to protect and promote Aboriginal and Torres Strait Islanders cultures will leave a lasting legacy for future elders and leaders. Unfortunately, the Public Trustee and CEO of the Queensland Public Trustee, Seme Zund, is not able to be here in person today. He will instead welcome you virtually.
Hello, I'm Seme Zund, the Public Trustee of Queensland and CEO of Queensland Public Trustee. It's my pleasure to welcome you virtually to Queensland Public Trustees Matters of Trust Forum. Thank you for joining us today. Queensland Public Trustee has been on a transformation journey focused on improving how we support our customers and the way we connect with them and the broader community. As an ongoing commitment to our customer first agenda, it's important for us to get out and talk with professionals like yourselves who partner with us in supporting Queenslanders in our community. Today's forum certainly will be a success if we can send you all away with your burning questions answered. I encourage you to put our panel to the test. We have an experienced group here and I feel great pride in leaving you in their capable hands today.
Thank you, Sam. We've got a really exciting morning planned. Throughout the event, we'll be inviting all participants to participate through the Q&A chat function. As you'll notice, the chat is actually turned off, but to the right of that, you will see a Q&A button. You'll be able to communicate with us in here. Thank you to everyone who has already sent questions in for our panel Q&A session today. These will be presented to the panel. We've received quite a few questions, which is amazing. If we do have time at the end, we will open the floor for everyone to actually submit some more questions. You'll be able to submit these through the Q&A chat function, and happy for you to do that anytime throughout our presentations. Shortly, Susan Blackburn, one of QPT's regional managers, will be presenting to us on all of the inner workings of QPT. We'll then hand over to Dylan Oliver, the Senior Advocacy and Engagement Officer from Council on the Ageing. We'll then hear from OPG, Vanessa Connolly, before we open the floor for our panel Q&A. It's then we'll get to dive into all the questions that you've submitted and potentially take on some more as well. I'll now pass over to Susan Blackburn from QPT.
Thank you, Ange, and welcome to everyone. It's great to see so many people joining our webinar today. Today, I'm going to take you through all steps QPT, who is the Queensland Public Trustee, and what we do. The Queensland Public Trustee is a statutory authority reporting to the Queensland Parliament through the Department of Justice and Attorney General. It was formed at the height of World War I and when the government unanimously voted to create Queensland's first public creator to make wills for Queenslanders. QPT has been supporting Queenslanders since 1916 and we have 15 regional offices. Today, I'd like to run you through some of our main services the Queensland Public Trustee offers to Queensland residents and people in our state. Queensland Public Trustee provides financial administration services to around 10,000 people with impaired capacity. Queensland Public Trustee is also trustee for minors around 4,500 children who have been awarded funds through the legislation or court orders. We're also trustee for charitable trusts, distributing approximately $9 million annually to our Queensland communities. We're trustee for a range of trusts, including testimony trusts, miners trusts, and charitable trusts. Charitable trusts administered by a public trustee are designed to benefit vulnerable people, such as those experiencing financial hardship, disability, homelessness, and domestic violence. Our charitable trusts provide grants and services to the individuals and organisations directly supporting the Queensland community. A few of our larger charitable trusts that QPT acts as trustee for include Queensland Gives Community Foundation, the Lady Bowen Trust, Queensland Aboriginal and Torres Strait Islander Foundation, and Fawn Foundation. As most of you are probably aware too, the public trustee manages an unclaimed money fund, and annually we're returning $4 million in funds to our Queenslanders each year in claims. Other services that we mainly deal with public trustee are available to all Queenslanders. They're preparing wills and enduring powers of attorney documents. QPT makes around 16,000 wills each year and 1,000 enduring powers of attorney documents each year. Our role in the community with making wills and enduring powers of attorney is an education campaign. It emphasises the importance of making a will and enduring power of attorney document. QPT encourages consultation with a qualified lawyer to draft these documents. And the message is not about choosing QPT services, but rather the general need for everyone to have a valid will and enduring power of attorney document. And the benefits of these include preventing elder financial abuse and minimising disputes. Only around 10% of the wills prepared by QPT in 2023 and 24 financial year actually included public trustee as executor. QPT can act as a financial attorney as well, and we can be nominated as the attorney under the enduring power of attorney document. We also tender trust administration when we can be appointed as trustee under a person's will, and we also administer deceased estates. Last year we administered around 2,000 deceased estates. In 2020, we introduced a great initiative called the Customer First Agenda, followed by the Customer First Strategy Program from 2021 to 2026. What this is we established our commitment to growing customers focused on the organisation and ensuring our customers are the focus of all processes and decisions. The human rights is a focus for QPT as well. And as part of our customer first strategy, QPT uses a structural decision-making framework developed in conjunction with the La Trobe University. We support our staff to act in accordance with the Human Rights Act and the general principles of the Guardianship and Administration Act. This enables us to strongly customer engagement and decision-making founded in the views and wishes of preferences of our customers. And in consultation with each customer support networks, trust officers receive comprehensive training and applying the framework. Some of the great achievements in 2024 and 25 year include the ones that you can see there on the screen. An exciting initiative, we launched our first QPT website, the new QPT website, and the new brand in 2024. Our website has been very popular with over 1 million views since it released, over 440,000 users, and our accessibility score for the website improved from 31% to 88%, which is great. As I mentioned before, with our wills and enduring power of attorneys, in 2024-25 year, we made 16,968 will appointments and 996 enduring power of attorney appointments. One of the great strategies that was launched this year was and it's Australian first for our customers. It's a customer portal called My QPT, and the portal allows our financial administration customers to see their information online and on the portal live, and send communications to our to our office directly via using the portal. Another great initiative that we commenced this year was Customer Connect. So Customer Connect is all about centralising our customer information to improve how we deliver services to our financial administration customers. 81% of our customer calls were received at first contact. Some more great plans and actions that we've been working on is the development of our disability plan. This plan is hoped to improve awareness about the services of Queensland Public Trustee providing to people living with a disability. Our new service delivery model is being implemented where regional-based teams provide holistic support for our customers. We also have our new online portal website for the unclaimed money application forms, which is making it a lot easier for Queenslanders to claim any unclaimed monies. Financial independence pathway is one of my favourite initiatives. It's a great action that the QPT has implemented. We have numerous programs, but this is one of our most popular and great initiatives. So Queensland Public Trustee's Financial Independence Program supports financial management of our customers wanting to take great control of their money. The FIT, we call it, can help a customer develop the skills necessary to manage their own finances or part of them, depending on their own goals. Over a 12-month period, we assist our customers to gain the evidence and required to apply to QCAT for a declaration of capacity, revoking our appointment as their financial administrator. We also established, as part of this initiative, a fund referral pathway to support them through independent advocacy advice about pursuing their declaration and assisting with their QCAT documents application. Since October 2020, we've had many customers achieve complete financial independence and QCAT have revoked their orders. 91 of our customers approximately are now currently participating in the financial independence pathway. An exciting initiative the Queensland Public Trustee initiated in 2021 was the Queensland Public Trustee Customer Advocate role. It's the first idea of any trustee company in Australia to take the initiative to have an in-office customer advocate. So the role of the advocate is to support network is not legally. Sorry, I'll start again. The role of our customer advocate is to represent our customers that do not have legal representation. And the customer advocate can facilitate a meeting to assist them in understanding the reasons of our appointment and our QPTs, our actions. In 2023 and 24, the customer advocate engaged in 138 customer matters, resulting in positive customer outcomes. Some of these noteworthy achievements include assisting care facility residents wishing to return home, and securing emergency funding for those in financial distress. So supporting our customers, which is the basis of our organisation, in 2024 and 25 financial year, I think I've already mentioned this, we drafted 16,968 wills. We provide various will and executive services, including private probate and other will services. So with our will service, if you are over 18 years of age and have decision-making capacity, you're able to make a will. So financial administration is an ever-growing field that the public trustee overseas in relation to our vulnerable customers. So like you've heard today, QPT can be appointed as a financial administrator for people unable to manage their own financial affairs. The appointment works as safeguard against abuse, exploitation, and neglect of the person. QCAT can appoint QPT as a financial administrator if there is no other suitable person. QTP currently provides financial administration to over 9,000 customers. This includes planning budgets, paying bills, applying for pensions and other benefits, entitlements, and buying and selling vehicles and properties. Our role as a financial administrator is very diverse depending on our customers' assets and situation. Unfortunately, financial abuse is something that the QPT sees quite often. And financial abuse of an older person is the misuse of theft of their money or assets. And it may include forcing an older person to sign over their property to assets, including any type of asset that they may hold. It may include misusing or taking older person's money or credit cards. It may be using undue influence or deception to change the terms of an older person's will or enduring power of attorney, or even forging an older person's signature. And Queensland Public Trustee does not have investigation powers, but we do work with our customer support to reduce the risk of financial abuse alongside other agencies. Steps we can take to reduce financial abuse. Some of the steps that we can take is consulting with our customer and their supports regarding their financial decisions and maybe timing of their payments to ensure that their payments coincide maybe with their shopping or their needs. Public Trustee has internal escalation pathways where we review our customers' accounts for suspicious transactions and withdrawals, and there is an escalation pathway for these situations to be reviewed and escalated. It's all about when we identify financial abuse, the customer's budget meetings are an important part of working with our customers and needs and expectations to ensure the funds are available for their benefit and use in the timely way that they're required. Financial abuse and some steps we can take. Financial abuse of our elderly is a confronting and complex issue. It's often difficult to identify victims, mainly because a significant portion of the financial abuse report in Queensland may involve family or friends or mismanaging their role as attorney. Some of the ways that we can avoid financial abuse is by completing an enduring power of a document and a will. And consider making, and when you're making your enduring power of attorney, consider who you're appointing as attorney. Are they a capable attorney? Is the attorney in conflict with you or any of the other family members in your life? Consider appointing more than one attorney, and consider whether more than one attorney should be acting jointly or solely. Consider limiting the powers of your attorneys and putting some directions in your enduring power of attorney of your wishes. And of course, making a will with your direct wishes is also a way of putting your wishes forward. If you suspect an older person is being abused and experiencing abuse yourself, please call the Older Abuse Helpline, 1300 651 192. Or if you witness domestic violence or any type of violence you're worried, then it should be, the persons at risk should be called the police and 000. To finish up, I'd just like to touch base on our fees and charges, which is always an important discussion out there in the community. So just giving you an update on where we're at with our fees and charges. So as you probably know, the Queensland Public Trustee recently completed an independent review of our customers' fees and charges, focusing on the areas of financial management, estates and trust services. The proposed fees and charges reform focuses on the following key service areas: financial administration, deceased estates and trust administration. The objection of the proposed reform is to adjust our fees and simplify our fee structure and make it easier to understand. And the proposed reforms aim to address fee sustainability and ensure relief to our vulnerable clients. We have implemented some cost of living measures already, such as freezing our annual index of reduced fee increasing and reducing certain fees and benefits to thousands of our customers already. So subject to the government approval and financial management fee reforms, which are expected to be implemented by the end of this year, we'll follow on with those reforms for deceased estates and trusts within the next 12 to 18 months also. So just finishing up with our trusts, which I've mentioned previously before, but just a little brief outline on that. So trust can be established for the preservation of assets, for tax planning, providing of children and people with disabilities or charitable causes. A trustee is either a person or organisation is appointed to hold money or people on behalf of the beneficiary of a trust. So Queensland Public Trustee is trustee for several leading philanthropical organisations, including Queensland Gives and Community Foundation. So that's all for me. I will thank you to everyone for listening. And for the next session, I'd like to introduce you to Dylan Oliver. Dylan is our Senior Advocacy and Engagement Officer with the Council of the Aged of Queensland. Dylan will provide you an overview of CODA. Thank you, Dylan.
I was not on mute. Good morning, everyone, and thank you for joining us. And I appreciate the opportunity that the Queensland Public Trustee has offered the Council on the Ageing to work with them on this webinar. Welcome, everybody. I've got 5 minutes, so I'm just going to tell you a little bit in a nutshell about what the Queensland Council on the Ageing is. So we are the peak body for older Queenslanders across our state, and we have a strong focus on making sure that we are listening to the voices of older Queenslanders and amplifying that, and that government, businesses and community are responding. So we're working in partnership with community sector, we work with the government, we do a lot of work on many of the other things that we do. I'm just pressing on this to move to, there we go, to the next slide. So we've been around for over 60 years and we advocate for the rights and well-being of older Queenslanders. And we do that in a number of ways. For example, with government, we do make major submissions to inquiries that are held into matters that are important to older Queenslanders and make sure that they can age with dignity, independence and purpose. So the way we do that, for example, in the last not too short 6 months or so, we've been into the inquiry of elder abuse and made submissions. We've gained insights, done surveys, spoken to workers and everyone across the state. So we're listening to the voices of older Queenslanders, and then we're also using our own insights and information to advocate to make a change for the better and make sure we're living in an age-friendly Queensland. We're also doing that in a way that makes sure that we are known across the state and we don't forget our regional and rural remote areas. An example of that is in 2 weeks' time, we'll be out at Longreach with the public, along with the Queensland Advocate and also ADA Australia. Dr. Catherine Barrett will be joining us from Celebrating Aging, and we'll be out there talking about social isolation, because social isolation and the prevention of that across our communities is an issue that we need to be at the forefront of, along with our communities. So another thing that we do, we make sure that everyone's voice matters. Ageism is a major challenge today. And look, I was just online earlier this morning. You should never scroll through Facebook, but I gave this example at the workshop, and in my feed this morning, Warner Brothers had something about Madonna, who's 67 years old, so she's hardly ancient yet, but she's an example. All the commentary underneath the fact that she might be releasing a new album soon was around how old she was and how she shouldn't do that and she should just give up and stop now. And I just thought, what makes an older person not able to do what they want to do and create for other people? So you don't have to like it. You can either love or like it, but just for example, that is a small example of the way someone who's not the same age as a much younger superstar is suddenly, after 40 years, not able to continue to contribute in a positive way to society and share their creative talent with everybody. So we want to make sure we fight ageism, we fight elder abuse. We also at the moment, there are 1.7 million Queenslanders who are likely to be aged 65 and older by 2053. So that's quite a lot of Queenslanders. And we're preparing for the future. We work with so many different agencies and advocacy nationwide. We also, obviously, an example in Queensland is the Older Persons Advocacy Network. But everyone, we want to make sure that we partner with people, but we also contribute to changing. We have e-scooters, for example, as something we've put into an inquiry. Currently, the Queensland Productivity Commission, we've responded to their livable housing standards, design standards, because they want to reduce some of that. And there's about 52 community organisations that are advocating to keep those reforms, which are very important, for example, for people with disabilities to be able to access their homes. So anything that can make people's lives better, can keep them staying at home, feeling dignified and able to be connected to their communities. We're very strongly in support of that and have been doing that for over 60 years. I mentioned some of our priorities. I'm conscious of the time, but another thing, we do Queensland Seniors Month, which starts, which is throughout October, so we're almost there. This year is Connect and Celebrate, and we work with the Queensland Government through the funding they provide for us to deliver that program statewide. Up in Cairns, we've got the culturally and linguistic diverse communities and people with disabilities that we support through our Care Finders service, which connects those people that need a little bit more intense support to make sure that they are able to access aged care services. So they have more barriers than a lot of other people may have, and our team helps them. We are looking at the mistreatment of older people. We're also looking at intergenerational issues, and we make sure that carers and people like that are involved as well. So it's very much working with everyone. To sum it up, though, what we do is we listen and we also research and gain the insights of Queenslanders as they age, and we want to make sure that we put those forward so that we have laws and services and initiatives that support people to age well and be part of their communities. So just to finish off, I might just click on the next slide. We're not going to do questions at the moment, but if you need to get in touch with the Council on the Ageing, we're very easily able to respond to your emails. Phone number there is statewide 3316 2999, and our website has a lot of information that you can go. We're also on Facebook, but I think that's 5 minutes, Angela, so I'll reluctantly have to stop sharing, and I would love to say thank you to everyone for listening today, and please contact us if you have any questions. Thank you.
Angela, I think it's over to myself now.
Go, Vanessa.
I just don't have the take control. There it is. Thank you. Amazing. Thank you for that, Dylan and Susan, before. I just want to start by saying sorry about my voice. It's still a bit croaky, so I may have to just pause for a moment here and there to take a sip. My toddler brought home her sickness last week, so I'm very grateful for that. Can I just confirm that you can see the slides? Everything's up there. Angela is? Yep, perfect. Okay, I got some thumbs up. Awesome. Okay, so my name is Vanessa. I'm currently the acting manager of the investigations team at Office of the Public Guardian. So I will run you through essentially, just having some issues here with the slides. So 1 second, I'll run through. Here we go. Okay. I promised last time I asked, can I just confirm that you can see the public guardian with the thumbs up slide there? Amazing. Okay, we got there. Okay. So yes, like I said, I'm from the Office of the Public Guardian Investigations team. I'm sure a lot of you on here would have quite good knowledge of what we do, but essentially our overarching responsibility as a statutory body is to promote and protect the rights and well-being of adults with impaired capacity. And we also have a function where we cover children and young people in out-of-home care. So my focus predominantly will be on the adult side today, and I'll talk with you as well about investigations. What I'll also cover in my little presentation here is about future decision making, how to choose a trustworthy attorney. Although I do note, thankfully, Susan did cover this a bit in her discussion there, so I won't double up as much as possible. I'll cover also when to nominate or situations where it might be appropriate to nominate the public guardian as your attorney. And then jump into decision making and our investigations function as well. Okay, so essentially when we're thinking about how to plan for the future, particularly when it comes to your decision making, it's interesting because when I talk with even just in my work capacity or in my social circles, a lot of people will talk about wills. But a lot of the time, people are doing their wills, but they're not also thinking about their enduring powers of attorney or their AHDs or their general powers of attorney. So essentially, what we need to then start thinking about, particularly when we turn 18, but also even more when we're aging, is what would ever happen if I was in a situation where I couldn't make a decision, and obviously I was still alive. So that's when your enduring power of attorney will come into place. It's personal and financial in Queensland. Different states around Australia do it slightly different as well. You've got your advanced health directive, so you'll set out your preferences and your choices for your medical treatment and your healthcare. And then your general power of attorney. So that's a typical one. For example, if I was going overseas and I needed some property matters sorted while I was away, I might give that power to a friend or a family member. So choosing your attorney. Similar to what Susan touched on in her presentation, it's really, really important that you think about who in your network you trust to make decisions on your behalf. Also subsequent to that as well is you may have someone that you really trust quite a lot, but they might not be the best person to manage your financial decision-making for arrangements, for example. So as an example, my mum has done her enduring power of attorney, and I have a brother. One of us is great with finances, the other not so much. So she's actually given different roles for both of us because she's kind of capitalized on where our strengths are for her decision making. And that's what works really well for our family too. So essentially what you really want to look at though is the person needs to have good decision making skills. They need to have good communication skills, be committed to the role, and also have good organizational skills. I would always say as well that if you are a person who is being appointed as an attorney, that you should really look at the Powers of Attorney Act. Obviously, you don't need to read it start to finish, but have a look at some of the places in terms of what your decision-making area is. So it's if you're a financial attorney, have a look at the sections that apply to that. We have fact sheets as well available on our website, which are a bit more in plain English than just picking up a piece of legislation. And that kind of steps you through what your responsibilities and your role is as an attorney. So that's briefly what I just started to touch on there in terms of understanding the document. The biggest thing that you really need to kind of put at the forefront of your mind if you're in an attorney role is essentially act in the adult's best interests. So prioritizing their rights, their wishes, their safety, their health, the independence and the community participation. You've also got avoiding conflict transactions or conflict of interest. So keeping your property and your financial matters separate and avoiding any transactions that might benefit the attorney or a family member. So a typical example I can give on that we do see a bit in our investigations is where a nephew, for example, has purchased a car off their uncle who has lost capacity. The car's worth $25,000, but they've only paid $1,000. Maybe the stamp duty's covered, for example. So that's a very typical situation where we will see that the family member has benefited from that transaction and the adult has lost out, essentially. Maintain accountability. So this is where specific to financial decision making, where the attorney needs to keep accurate records. The legislation doesn't dive into what accurate records actually means. It's open for interpretation, but that's not such a bad thing because it means that there's some flexibility. So it doesn't mean that you need to be an accountant to be a financial attorney, for example, but it's a good idea to keep receipts, to keep a spreadsheet, whatever it may be, just some form of record of your dealings for that adult that you're acting on behalf of as their attorney. If there are joint attorneys or severally appointed or successfully appointed, you need to also act with those other attorneys when you're making decisions. If it is, though, a situation where it's a several appointment, where you have one attorney first and then the second will come in if that first attorney can't act, it doesn't mean that you need to they don't need to be involved in the specific decision every single time. But in saying that, it's also good to always speak with the family that's involved with the adult when you're making a decision and get their views and wishes. But at the end of the day, if there is just the severally appointed attorney, they're the one who's able to make that final decision, whatever it might be, financial or personal. And then in every type of decision-making arrangement or any type of decision that you're undertaking, you need to follow the general and the healthcare principles that are under the legislation. Across. So nominating the OPG as your attorney. If there is a situation where you might not feel confident that you have a suitable person in your life to undertake the role, so obviously this is more towards personal matters because the OPG only manages personal, you can nominate the public guardian as your attorney for personal and health decisions. You do it the same way. It's in the same form. You just nominate that it is the public guardian, and then you can actually submit it with our office, and we will keep it in our records where it's essentially EPAs that aren't activated yet. And then if there does become a time where you lose capacity, we are able to activate that enduring power of attorney and step up and make decisions for you on your behalf. If there is a situation where somebody loses capacity, as I'm sure a lot of you are aware, and there is no attorney appointed or there are no other decision makers involved, QCAT, Queensland Civil and Administrative Tribunal, we can appoint the public guardian for personal and health decisions and the Queensland trustee for financial matters as well. So understanding decision-making capacity. This is a really, really interesting field because it can be subjective. There can be differing opinions as well. And it is a complex domain because capacity is not just a one-all and be-all. There's different elements, different factors that go into what constitutes decision-making capacity. It's interesting as well because we've been having discussions in the office this week specifically about coercive control and how that comes into capacity too. So essentially, in Queensland, there are two tests of capacity, so the general test and the test for making enduring documents. Capacity defined under to there are three key factors that need to be, I guess, ticked off to come to the conclusion that somebody has or retains capacity. So they are that a person must understand the nature and effect of a decision. They must be able to make the decision freely and voluntarily, and they must be able to communicate the decision in some way. So we need all three of those to be true. And what I want to highlight here as well is that the legislation, the way that it is written is that everybody is presumed to have capacity unless proven otherwise. So the technical term around it is that capacity is rebutted. So it's not a situation where you have to prove that somebody has capacity per se. It's that you actually have to prove that they don't have capacity. On that as well, there's it might be the next slide. Yeah, I'll go into that in a little bit. But specific to an enduring power of attorney and an advanced health directive, when somebody is making an enduring power of attorney document or an AHD, the principal or the person making the document, they need to be able to understand the document's purpose and effect. They need to know their personal circumstances and the attorney's role, and they understand the powers that they are giving to that attorney and the scope of decisions, and that they're not being pressured into making these documents as well. It's not uncommon for us to receive concerns that an enduring power of attorney document is, I guess, I don't want to say the word invalid, because the only entity that can make a determination on an enduring power of attorney document's validity is QCAT, but we have concerns raised with us that that might be the case. It's a case-by-case basis as to whether we scope those concerns into our investigation. I won't go down that path because we'll probably be here for too long. But essentially, when we're looking at those documents, we look at the time that the person made it, and if there's any evidence at that time that they may have lacked capacity. So that's just a bit of a recap of what I've just spoken about. The big thing I wanted to kind of highlight here, though, is point 2, where capacity is decision specific and time specific. So we might see a situation where an elderly individual has dementia, for example, and because that can be a progressive decline, they may very well still have capacity to communicate and understand the nature and effect of their decisions for personal matters. So where they live, what supports they might need to stay in their home. But then conversely, when it comes to financial, that might be an area that they're actually declining in capacity for, because it potentially could be more complicated, more complex decision making. And we might ask a doctor to comment on their decision making for financial matters, and we may receive information back that they're great for personal, but they've declined and they no longer have capacity for financial matters. So it's not just a one banner covers all. And the other point I want to draw your attention to is point number 4, where capacity can be supported with appropriate help. So this comes down to the supported decision-making model that we've moved into in this space, where if people are given the right tools, the right information, and the right support, there are circumstances where they can make their own decisions by themselves. Sometimes it can be tricky determining whether that support is genuine. But we do see it, and if we're able to kind of link people in with advocates, for example, to be able to support those people to make their decisions, we definitely will kind of go down that path and talk with the supports or whoever might be involved to seek that as a potential option. So the role of health professionals in capacity. I think the biggest point to take away here is health professionals such as doctors and psychologists, they can provide helpful insights into a person's capacity. But the biggest limitation is that the medical opinions are not legally binding. So the only entity that can make final decisions on whether capacity is rebutted is QCAT and other courts as well. So in our investigations functions, we rely on reports from doctors, psychologists, geriatricians And that enables us to conduct our investigation. But if our investigations get to a point where we go to QCAT, we still need QCAT to be satisfied, or QCAT needs to be satisfied themselves that there's enough information to make a determination that that person lacks capacity in whatever areas that may be. So our investigations function. When can I report abuse to OPG? So like I've just kind of gone into there, is that we can only investigate when there is reasonable information that the person in question, or the adult we refer to them as, lacks capacity relevant to the concerns. They also must have to reside in Queensland, and they have to be over 18. So we obviously don't do children. If there's concerns about children under 18, that's for child safety. What we will look at, generally speaking, is the person's decision-making arrangements. So that can be an enduring power of attorney, it can be a guardian and an administrator appointed by QCAT, or it can also be an informal decision maker. So that person, the informal decision maker, is still participating in the person's life, helping them with decisions, making decisions for them, but there's no formal appointment. And we can also look at when there is no decision maker whatsoever, and there's concerns where that the adult may actually need a decision maker. So that's in cases of self-neglect, for example. One key point there is that if there is proceedings being undertaken at QCAT at the same time as we receive a request for investigation, we generally will not open an investigation because it's a bit redundant. The concerns can be raised with QCAT and that pathway can be taken. It would be a duplicate just to open an investigation at the same time. So the possible investigation outcomes, I like to think of it as a little bit of a continuum. So at one end, we have that the investigations are found to be unsubstantiated and we take no action. So we can either get to an end of an investigation and say that the allegations are unsubstantiated and we're closing, or if we are 30, 40, 50, 60% of the way through and the information that we've received at those points indicates that there is no substance to the concerns or the allegations, we may discontinue. Stepping up from there, we then move to a situation where one or all of the allegations are substantiated. From there, we then need to determine whether any action is required or what action is required for those allegations. So again, it's a bit of a continuum in terms of the level of protection and action that we take. So on one end, if there is a formal decision maker appointed, we can, so that's an attorney or a QCAT appointed guardian or administrator, we can provide formal advice to them. So that might be around personal matters such as you should go and seek to have an ACAT assessment for an elderly individual who might need more supports. We can also do a period of supervision for formally appointed decision makers. So that would mean that over a specified time period, we would have very clear guidelines of what we need to see in that supervision period in order for us to be satisfied that the decision-making arrangements are appropriate. So as an example, if we had an attorney who we had substantiated that they'd engaged in conflict transactions, during that supervision period, we may request that they send us at the end of each week an Excel spreadsheet of their dealings with the adult and their financial expenditure. And if there are, for example, conflict transactions that we're really worried about, we may actually ask them to go to QCAT to have those conflict transactions authorised if the situation calls for it. So at the end of the supervision period, if the formal decision maker has ticked off on all of those, we will close and then we have no further involvement. If it's an informal decision maker, we can provide education to them, but it's not a function under our legislation as such. And we would only be doing that in situations where we're satisfied that there's no ongoing risk to the adult. Stepping up from the supervision is, I probably would say our highest level of protection is our suspensions and our interim applications to QCAT. So we have the ability to suspend an attorney. We can suspend their personal powers and their financial powers. So during that period, it's a 3-month period. And as I'm sure you're all aware, if we suspend for financial matters, the Queensland Public Trustee is appointed automatically as the financial attorney until such time as we go to QCAT hearing. If we suspend for personal, the public guardian is appointed as the personal health attorney. Comparable if it's not an attorney, if it's a guardian, administrator, or a informal decision maker, we can make an application to QCAT for an interim order if we're that concerned and the risk is that high. How to request an investigation. It's our investigation request form is on our website. So it's pretty straightforward, the information we need. The key bits of information that we really do need is the person's full name, their address and date of birth. That enables us to do our checks and to request information relevant to the person and the investigation. We need some information about the person's lack of cognitive capacity. So that doesn't mean that we need at that point geriatrician letters sent or MMSEs sent to us, for example. We just need the key points. So if you're from Queensland Health, for example, if you're aware that the person's diagnosed with dementia, and if you have a diagnosis date, amazing, you can just put that in the form. If we don't have any diagnosis, that's okay. We don't absolutely need that. But then in that case, what we need is really good information about observations of the person. So you might be able to tell us that you met the person yesterday, they were in hospital, you met them yesterday, had a half an hour discussion, and you came back the next morning and they couldn't remember. Or they're not orientated to time or place. They don't know, I'm not going to say the Prime Minister of Australia because that changes every 6 days. So, but the typical stuff, something that you would expect the average person to be able to retain and answer. If you can tell us that that person's not able to do that, that will get us over the line to be able to commence an investigation. The biggest part as well is clear and concise, and dot points are amazing. Our investigation intake officers work really hard, and sometimes they have to sift through a lot of information. So anything that you can give us that is clear, straight to the point, just outlines the concerns and why, that is really, really appreciated. So once you send that form to us, we'll review it. Our investigation officers will get in contact with you. They'll talk with you about any points that we may need to clarify. They'll also let you know if there's anything that wouldn't fall within our scope. You'll then get an outcome as to whether we accept the investigation or not. If we accept it, it will then be allocated to an investigator, and they will conduct the investigation. If we decline, we won't just shut the door in your face, definitely not. We will talk with you through why we are declining. Often it's because we lack information about their capacity, or because the concerns don't meet threshold or aren't in our scope. If that's the case, we will always talk with you about why, and we'll always give you alternatives of where you might be able to go. If the only other thing I would just quickly say on that before I show you the alternatives is, if we decline an investigation request, it doesn't mean that future requests aren't relevant. So there might be new information that you need to update us on, or contact us again, and it might be a new investigation request. So this is just a quick other referral pathways where we might send you if we're not appropriate. Advocacy support, mediation, the police if it's a criminal matter, elder abuse helpline. Yeah, just to name a few. There's some further information that you can always access. Our website as well is a really good place to start too. Perfect. There's our contacts. I hope I didn't go too far over time. Apologies if I did, and sorry for the voice.
Thank you. Thank you, Vanessa. That was great. Thank you to everyone, actually. Dylan, Susan, some really great information has been shared. So that's amazing. We are now going to head into our panel Q&A session. We have our panelists here today. So we have Susan again from QPT, who'll be joining us as a panelist. Jay Cross, he's one of QPT's Directors of Special Operations. Vanessa Connolly from OPG, who we just heard for, will be back with us. Lisa McDermott, she's also from OPG, and she's a Principal Guardian there. So I will now start with the questions that were submitted. We've got a couple of questions as well in our Q&A chat. If we get time, we'll jump over to them. So question 1, if all panelists can just unmute yourself when you're ready to talk, that would be great. So question 1. There's been feedback that QPT have moved to a teams-based approach rather than an individual. Can QPT outline some further detail about this model change and how this approach will further support clients in timely access and decision-making from QPT? I'll now just pop the question up on the screen so that everyone can see it.
Thanks, Angela. So I'll take the first question. So the short answer to that is yes, we have transitioned to a teams-based model. There's a couple of main components to that. The first one is we have a customer support team where all financial administration customers and their support networks can call through, and we will ensure that whenever they call, a person will be able to handle their calls, either meet their needs or get them in touch with the right person. That approach was taken based on a lot of customer feedback that at times when people called, if staff were away, seeing other people or sick or what have you, they might need to wait for that person to come back before those decisions could be handled. So the customer support team's main role is to provide that service at the point when they ring, and if not, get them in touch with the right people so that they can help them. From a regional team's point of view, in the past, we used to have obviously one-to-one case management for those customers, which was a great model in many ways. But what we also found that it was very reliant on the person being available, being present, and having the knowledge and skills to manage different aspects of someone's financial affairs in varying degrees. So our new model is where we have regional teams, or our new interim model at least, where we have regional teams, is that we still have a primary trust officer who is the work group manager who oversees all of the work and is an experienced staff member, but we have sub teams that will focus on skill sets. So if it's accommodation and those sorts of things, there's an accommodation team there who become much more au fait with how to make those decisions and make those decisions quickly, and they can devote their time to upskill and become experts in that field. Same as our budgeting teams or our, I suppose, ad hoc type request teams. So the hope is that by having those different teams that are able to be more skilled, we will be able to make those decisions quicker and prioritize with clear focuses on different aspects of somebody's life. So that's what it is. It's an interim model. We are still looking to work with business partners to redefine that even further. But this was our first step to moving to a much more collegial way of working across the business rather than in regional silos or trust officer silos.
Thanks, Jay. That's great. All right, we'll now move on to question 2. Question 2. QPT have provided feedback on occasion that there can be insufficient detail included on QCAT applications, hindering their ability to complete timely financial assessments. What further steps are being taken to provide feedback to services where insufficient detail is being submitted, and steps to support clinicians in including the details required to expedite the role of QPT? Will there be resources to support?
Thanks, Angela. I'll take this question. It's a really good question. And currently, QPT and myself in person have been working on some great initiatives with Queensland Health employees and representatives from both Queensland Metro North and South, and actually even the coordinator from the statewide hospital QCAT hearings program, and a representative from that program as well. So we're currently working internally and with a social worker check sheet because we've heard the inquiries, and it is an ongoing issue with being able to supply information to get our customers through to the information that we need to get things escalated. So with the escalation process, currently there's an escalation process in place where Metro South and Metro North have my details and a few of our director details in relation to our emails and contact. And we often get emails straight through to say that, oh, we need this one escalated from Queensland Health. Can you help? And it's just a matter of myself and the contacts looking at it, and we escalate it through to the regional manager. So that process has been working quite well. But we're always looking for ways to continue to improve our connections with Queensland Health and prioritise our communications. Thanks.
Thanks, Susan. That's great. Question 3, this one's in relation to communication and collaboration between QPT and OPG. Within health services, many clients will be appointed a public guardian under OPG as well as an administrator via QPT. On occasion, feedback has been that there are challenges from OPG contacting QPT in a timely manner. How are OPG and QPT working collaboratively to support clients requiring administration and guardian involvement? Are QPT working to triage process to support priority cases?
Angela, this is another one I'm happy to start with the QPT. Myself, as a regional manager of Brisbane Financial Management Team, meet regularly with the regional managers of the Brisbane Public Guardian. So we've got Sam and Kristen, who are the managers. We meet quarterly and to talk about any mutual customers, any way we can improve things on either side better. If there's delays with some sort of customers' decisions, we have escalation process with contacting each other to escalate on either side where there may be a gap. I think it's important that any decisions and requests that come from Queensland Health or any other parties that they email, the emails include both the Queensland Public Trustee and the Public Guardian, so there's no miscommunication there. That's currently what we're doing, and it seems to be working really well with that regular communication and catch up with the Public Guardian. I don't know whether the Public Guardian want to comment on that as well.
No, I'll just agree that yes, at all different levels of management there is discussions around systemic issues, occurring regularly. What I would just suggest as well, particularly to Q Health, is that if, they've got an issue, to actually in an email to the Guardian, outline what's required and stipulate the time frame. And then that way, if escalation processes are required, then the Guardian can actually do that through their supervisors, team leaders, etc.
Thanks, Susan and Lisa. It sounds like there's some really good collaboration going ahead in the background, and some really good tips as well, especially in terms of, I guess, emailing both OPG and QPT. That's a really good takeaway, I think. Question 4. There is a high demand for residential care beds, and bed offers are requiring a fast decision, 48 to 72 hours. Before the bed is offered to another client, how is QPT responding to this demand to ensure clients with administration involvement are not missing out on placements?
And I'll take this one. I will answer Jane's question. It does just come up in the chat because it related to our first question as well. The short answer to that, Jane, is we have really detailed notes, and we have a note for all customers, which is called a Know Your Customer note, where it lists things about communication preferences, best times of day to speak to somebody, what people's goals and preferences and aims are. And if there's work in progress, that's included there as well, which all staff have access to. So whether you're speaking to someone in our customer support team, our accommodation team, our budget team, or our contact teams, they all have access to the same information. And we also have daily stand-ups if we're handing over work between different teams within our environments as well. So I'm not going to pretend we get it perfect all the time, but we have tried to build some safety nets around that to make sure that that happens. For high demand for residential care beds, I think it's the challenge of our time in an aging population with limited resources. So to answer it in a simple term, how we're responding to, so as Sue mentioned earlier with our accommodations team and that escalation pathway that I'm reasonably confident most regional managers have with their local HHS. If there are urgent matters to escalate to those managers, we also aim to make decisions as quick as we can, which I appreciate at times can be frustrating that we can't make the decision as quick as people would like. But for an administrator, our role is to make the right and the best financial decision for somebody. And whilst we appreciate the guardians might be in a position where they are happy with an accommodation decision, and obviously Queensland Health and the social workers and support workers in that environment are also aware that that place is right for them, we are somewhat beholden to third parties when it comes to confirming financial assets and interests. And the decision we make when somebody enters aged care continues beyond. So if we make a decision with the wrong information, it can have really significant financial consequences for that person going forward in the sense of the fees they pay or the deposits they either might have to pay that they could have otherwise avoided had we known more information in advance. So if we are confident and comfortable that someone is likely to be what we would call a fully supported resident, we can make those decisions relatively quickly. It's about being confident with the information we have from Services Australia and what's involved in that initial onboarding process. But in situations where a customer might have more assets and be in that moderate or non-supported type environment, we really are beholden until we can confirm that and make an informed financial decision. So we will try as hard as we can. There could be times where perhaps we need to look at alternatives to a permanent long-term placement if that's out there, because I appreciate, as I'm sure you all do, that a clinical hospital setting for somebody who no longer needs that type of support is not the best place for them. But if we were to enter them into permanent full-time aged care without knowing what their asset positions are and the way that that legislation is written and is continuing to be reviewed, there could be some dire consequences for that decision if we don't have the information in advance. Ange, back to you.
Thanks, Jay. Okay, question 5. What's the current QPT model for financial administration given the recent changes, and whether this will be a permanent arrangement, as well as how to provide feedback on the current model?
Sure. I sort of covered a little bit in question 1. It is an interim arrangement. So where the PT or the QPTs part of a journey of reviewing how we provide our service to all of our customers, whether that's within our financial administration teams, our trust teams, or our deceased estate teams. So we're in the process of finalising what that end model will look like, but it is accepted that based on research and also based on customer feedback around not being able to contact the right person when they need to, and that along with that feedback, people actually, the right person for them is really the person who can help them when they call. So trying to skill our team so we've got people available for the whole time we're open to be able to help them when they call. That's where we're going. So it's accepted that we'll probably be moving into a more teams-based model. Will it be its current format where we've got regional teams that are really small teams spread all across the state, or will we have much more specialised teams that might look into legal matters or might look into real estate or dealing with pensions and entitlements to make sure that people are getting the right pension at the right amount, that they're never missing out on a payment they can get. All of their Medicare claims are lodged, all of their health insurance claims are lodged. So it may look far more broader than that. For the customer themselves and their support networks, whatever model we end with, there will always be a way for people to contact us by phone. There will always be a person on the other end of the line who can meet with you, whether that's by Teams or in person, and we'll be skilled to help you at the time you need us, when you need us.
Thanks, Jay. Question 6. Is it possible for complex mental health customers to receive some sort of coordination from QPT to ensure a consistent approach?
Sure, me again. I'll probably answer a few because I know Sue's done a lot of talking this morning. So a consistent approach, ideally, yes. So when I touched on before around our Know Your Customer notes and those sorts of things and our budgeting discussions, there are expectations and detailed notes made at the time of those things around goals, what the approach is, and how to make decisions along with what within budgets is there. The other thing that we're looking to do, and it's a change for us, because as you sort of move from that one-to-one model into a team model, your budgets kind of have to change as well. So there is some work going on in the trust officer land around putting some different types of categories in budgets for additional requests or unforeseen expenses. So that can be discussed with the customer throughout the year and assist with, I suppose, that consistency in decision making. The other thing that we've done is that we've tried to create a consistent approach with how we make decisions, particularly for that ad hoc, spur of the moment type request. So we now have one team that has been highly trained in our structured decision making framework, which really looks at what's the need for the customer, what priorities and constraints there are there other options, and what are the consequences of those decisions, communicating that with the customer where we can, and then making a decision that's the least restrictive approach for them. So whilst in the past we may have been very reticent, I suppose, at times to release funds to customers for knowing what might be coming up, or not what might be coming up, but for the big unknown that could happen, our approach now really tries to centre around supporting customers to access their funds when they need it, which at times you might see us being a little more open with where we would approve funds for someone.
Thank you. Question 7. For those on the Financial Independence Program, how are QPT supporting customers to gradually increase their independence if a different approach is taken by each QPT staff member upon each interaction? I have felt the need in my correspondence to detail the client's lack of understanding due to concern that it's not being picked up, with there no longer being a consistent case manager.
And I can answer that one. So currently our FIP program, Financial Independence Program, the customers that are on that have all very individual experiences and circumstances. So we need to consider each customer in its in their own individuality. And some customers like to do things differently. Some of our customers on the FIP, they just like to manage one bill and take control of a few bills. And other customers are on a journey for a declaration of capacity over a 12-month period for a submission to QCAT to totally regain control of their finances. So, you know, with customers that are on our FIP program, they still have a budget and a valid budget, and they still need to work within our budget. With the FIP program, we rely on our communications with the customer and their support network throughout that 12-month period to gauge how the customer's going and whether we need to change the FIP a little bit differently, whether they need more control over more financial bills, or we need to step it back a bit because they need to take things a little bit slower with their needs. With the Financial Independence Program, when you're on that, there's a connection with our financial literacy programs, contacts and organisations that can assist our customers if that's what they're wanting to do and move towards that. But at the end of the day, you know, it doesn't matter if our customers, you know, they might be on a FIP program more than 12 months, but they're gradually gaining confidence and requesting us to pay more, themselves to pay more bills. And we adjust that obviously within their living expenses. We might increase their living expenses to allow for the certain bills that they want to take control of and pay. And we do monitor that, as I mentioned. Yeah.
Thanks, Susan. Question 8. There's a recent pattern where guardians are no longer providing Queensland Health inpatient teams with copies of the adult NDIS plan when requested. However, asking for input around whether the supports plan are sufficient for the adult's needs, as they do not know the adult well. May this please be considered appropriate to share with relevant teams when required, as this can impact discharge planning.
Hi, thanks. So normally we wouldn't share just due to privacy and confidentiality reasons, and that's sort of been a standard response since the NDIS sort of rolled out. We can definitely provide an outline of what is in the plan if that's required. I'm not just in regards to, yes, we definitely need to know the supports from the medical side that's required so we can support an appropriate plan. But what I would recommend to health services or to Q Health is if they are requiring a copy of the plan, identify in the email to the Guardian why it's needed, barriers it's causing without having a copy of that plan, and all matters are case by case, so that will be responded to just individually. Yep.
Thanks, Lisa. Some great tips there. Our next question is one that we actually get quite a bit. How can we advocate for face-to-face appointments to the hospital for those patients wishing to complete a will but are unable to travel into a QPT office?
Thanks, Ange. I'll take that one. And it's a very important, popular question, as you mentioned. So the QPT has an outside will making team that can do home visits and in-hospital visits. And it's best to contact our 1300 number, 1300 360 044, or visit our website. And we do try and do outside appointments and visit hospitals for appointments as much as we can, but we do unfortunately recognise that our free will making service is a very popular service, and it is in high demand, and at times we're unable to make a deadline and get to an outside visit, whether it's a hospital or a person's home, within a expected time frame. And with those ones, we have some details on our website what the options are, but there are other options with regard to a solicitor or a homemade will, or other options like that. It just depends on its case, but we do endeavour to get to the hospitals and do outside will visits on a regular basis. Thanks, Ange.
Thanks, Susan. Question 10. How can we add... Oh, sorry. That's not moving over. Oh, we've got a double up there. I'll jump over to... is my screen moving? It's just not moving on my end. Question 11. What is the best way to escalate concerns with QPT about a client's access to money? Other people in their life acting inappropriately about their money?
That's me, Angela, and we did miss the QCAT process one before it, but we'll deal with this one first. The best way to escalate concerns with us about a client's access to money and other people acting inappropriately is realistically it's to call us. You can send us an email or write us a letter, but I think if you've got those concerns, it's best we know about them as soon as possible. So if there's an urgent matter, and whilst the CST will try to help you wherever we can, for those more complex and urgent matters that sort of can't wait any time, we would put you through to the regional team straight away, so that you can talk to the person about that, work out a plan. In reality, we're probably going to have to talk to the customer themselves, because obviously it's their money and it's their finances and they have a right to be involved in that process. But your information can help guide us on how we can do that most safely, particularly if someone is taking advantage and could perhaps be influencing and putting that person at risk. So a phone call is probably the best way. If there needs to be meetings and those sorts of things going forward, the teams will organise that. And then we need to really balance it. So whilst we would never want someone to have their money being taken advantage of and acting inappropriately, we need to put safeguards around that. So that might be things such as sort of securing the main assets or the main income, talking about ways where we can get money to a person's bank account to minimize that risk. But we do need to balance how someone can still access the community and have access to funds versus being completely restrictive. So that's where conversations with you, the customer, and the wider support network who are appropriate can really help us come up with a plan that works for them. The question before that, Ange, was around the QCAT process when an order is made. So I'll pass that one back to Sue, because as a current regional manager who has a number of people who deal with this on a day-to-day basis, she'll be best placed to talk you through that process.
Thanks, Jay. Thanks for that. Yes, of course. So basically, once a QCAT decision's made in relation to a customer, usually that decision or that order, they call it, is emailed out to QPT within a few days. Most orders are received within a few days of the hearing being held or the decision being made, but in some cases it may be a little bit longer. But once those decisions are made, they're emailed out to QCAT, to a general mailbox at QPT, and from that mailbox, a QCAT liaison officer, we call that person that deals with all these orders at our office, he emails them out to all the relevant regions where those QCAT orders are, for example, where they will go for the region to be allocated to. So from there, the important part is that the start of the journey is our client liaison officer. So our client liaison officer is an officer that initiates and deals with all our new customers. They make initial contact with the customer and their supports to gain further information. Part of being appointed by QCAT, we receive copies of the initial application that was made by the relevant party, and we rely on a lot of information that's in that paperwork to initiate our general inquiries. So from there, our client liaison officer, like I mentioned, will contact the adult and supports, arrange a meeting, whether that meeting's by phone or in person, and find out all the financial information that we can to ensure that we're administering the finances as best as a whole. That may well be in some instances where some of our customers, we're not able to obtain a lot of information, and we need to do a lot of research and writing to all banks and organisations and doing the relevant searches. So part of that initial client liaison officer role too is to answer any questions about our role, talk about our fees, talk about what to expect from here, looking at establishing a draft budget for our customers, and just generally answering any questions and concerns in relation to the new order. So thanks, Ange.
Thanks, Susan. A really important process, that one. Okay, now we'll jump over to 12. What is QPT's method to work out the budget and when to decide not to provide funds to a person for a specific purpose like furniture, even though there might be funding available?
I'll jump in on that one, and I'll answer a couple of ones that have been gone into the chat beforehand. So, Jane, your question around sort of helping us create the Know Your Customer note. Yes, you can. Our customer support network, service providers, all of their input can go into that note. So the Know Your Customer isn't about just the customer's views, it's about a holistic view of that customer. So whilst we will keep records of every email and every conversation, the Know Your Customer is a working document that as things change, whether that's information by support providers, family, the customer themselves, or trust officers working through things, it's constantly being updated. So everybody involved in a person's life helps shape what that Know Your Customer note looks like. Face-to-face meetings ever held for any other reasons? Budget reviews? Yes, we can have a face-to-face meeting for any reason. We find that at times coming into our office can be challenging or difficult for people. So that's why you'll see a lot of our communication being over the phone or via email. But if people want to have a face-to-face meeting, because you can get a lot out of that, we can do them in our office. We can have Teams meetings as well, where we can set people up and sort of have that dialogue. It's probably a service you wouldn't have seen a lot from the QPT and underutilized, but there's a lot of work going on behind the scenes to try to encourage staff confidence in using that system for those customers who feel comfortable using it. Back on to question 12, which is our method to work out a budget. Budgets are obviously, we have an obligation under the legislation that we have to review a budget every 12 months. That's not to say that we can't review budgets more frequently, and common times when that might change is if someone's moving accommodation, received additional funds, whether that's through a TPD claim, a legal matter, or anything else, or their situations have changed and it's just not working for them. So we can review a budget more frequently, but at a minimum once a year. The way we can set that up really depends on the customer and their circumstances. So some customers might want to have a lot of people involved in that discussion, which we would support them to do if that's the wish that they've given us. Others want to try to do it on their own, or simply can't do it through to their disability, where we would engage with service providers to help us with that. The trust officers themselves would generally create a new budget based on the old one and the expenses for the last 12 months. So if we know there's been a lot of extra requests, or pensions have gone up, or chemists have increased, or utilities and all those things, we try to factor all of those things in before we meet with the person, so we have a really realistic understanding on what the current lay of the land is from the last time we did it. We should then talk that through with the customer if they want. Or we can start talking through about how much funds they're receiving. Is it at the right intervals? Would customers like more money, less money? Is there a goal or a plan that they're saving for? How can we build that in? Is there times of the year when a customer might want to access more funds, whether it's birthdays, holidays, certain events in their local area, or certain things like that? And do they want to start looking to save money for sort of rainy days or unforeseen expenses? Some customers do want to do that. For savings. Some customers don't, and they want to have every dollar or cent that they can have, and our role is to talk through the consequences of that, but then support the customer make that decision. They still have a right where they can communicate and have a view to shape the budget as best as they can, and have that element of dignity of risk around what they're doing. As for the question around furniture, obviously I'll give you a very standard response, but there could be idiosyncrasies in the situation. But generally speaking, if a person required furniture and they had either funds within their budget to purchase that furniture, or capital savings, so money in a bank account or term investment or something like that to buy it, and there was a need for that, in reality, we should be supporting the customer to buy that furniture. So if we haven't done that, please reach out to us if you haven't already, and we can sort of go through and do a review as to why that happened. There can be times, depending on the customer themselves, whether we might want a quote for that, or if the customer is a little more independent, we might pay funds to their bank account and support them to go and buy the furniture. And then if at times the person wasn't so successful in buying the furniture, we could be a little bit more hesitant to be as open by sending funds out again, because we've got to balance that independence and the need to use the money for the right thing. So there's a few variables there, but the short answer is, if they had the money, if they had the need for it, we should be looking to support them to buy that furniture.
Thanks, Jay. Okay, question 13. Does QPT meet with the client to review both the client's capacity to self-manage their funds and the budget?
We do meet with customers wherever we can, not often in person, and that is because often when we look to review a budget, most of the customers we talk to want the budget reviewed as soon as possible, rather than wait a week or two to have a meeting itself. But we can meet with customers if they would like to in person, or as I said, via Teams, or we can do multiple chats, conversations, and those sorts of things. Part of our budgeting process, which we changed, and we're testing my memory now, either in 24 or late 23, was around not so much about capacity, but around how do we ensure that that budget is as least restrictive and supporting autonomy and independence as we can. So part of that budget review is our trust officers should be talking to customers who are expressing an interest in greater independence around our financial independence pathway, and whether that, and Sue's touched on it a little bit already, but whether that's around going onto the pathway itself for full independence, whether that is how could we structure budgets to, if someone's receiving payments multiple times a week or every week, it could be if talking about, well, if they can manage that money, perhaps we could reduce from weekly payments or bi-weekly payments to fortnightly when we start to see that budget sort of working and people being able to manage their money. Can be things like that. Unfortunately, I'm going to get a little bit legalistic and going to what the public guardian said before. Our role is not to review someone's capacity. We don't have authority to do that. We can look at someone's ability to act independently, but the capacity question rests with QCAT and it stays with them. So if we're appointed for all financial matters, then QCAT has decided that there's a need for us to manage all financial matters. And whilst we should, and hopefully we do, look at ways to be as ways to support independence and autonomy as much as we can, due to the effect of whatever order we're appointed for, we hold the responsibility as the administrator for that. So that's why you might see us taking sort of incremental steps to sort of make sure that, particularly for customers with little amounts of savings, I suppose the cost of failure can be higher for that person than someone who has a little bit more money. So it's around trying to tailor a budget with independence to the customer circumstances to get them to where their goal is.
Thanks, Jay. You've actually answered a little bit of the next question in this one.
Sorry.
No, that's totally fine. As a part of capacity review, is PT actively referring clients to the financial literacy program? This is the financial independence program.
Yep. So I've touched on that a little bit, but yes, we have a few avenues. So like I mentioned, budget is one. We also have an arrangement and a relationship with Queensland Advocacy Incorporated around supporting customers for advocacy with the QPT, but also to seek declarations of capacity. And something that we often find when we refer customers, and if customers want that referral, we will do a warm referral across to them so that QAI can reach them out and act independently for them. They will often assist customers with that, with getting onto that program and explaining a little bit better than has the benefits, I suppose, of it. The program itself also links people into funded services in their local communities for financial literacy. So whilst we will put the guardrails and the structure around payments and those sorts of things, whether that's centre pay deductions, different monies and bills going, what have you, the other part of that program is finding providers and giving customers and their supports links to literacy programs within their area. And then obviously part of independence is showing that you can do it. So then customers with that support network engaging with that to build those skills. I think that's what I've got for that one, Ange.
Yeah, no, excellent. All right, so this is our last question for the pre-submitted questions. So if anyone has any other questions, just pop them into the chat now and we'll move on to those next. So question 15, does it fall within QPT's role to review the income of a client and to instigate a change of social security payment, example, youth allowance to disability support pension?
And I can answer that one. It certainly does fall within our role, and it's something we often do. We actually have a specialised expert staff who are knowledgeable in Centrelink and human services entitlements and legislation. And we often work with them to ensure that all our customers are attaining the correct entitlements. and that includes things like youth allowance they may be on youth allowance, or they may be entitled to a DSP. So we make that application for conversion to get them on a DSP, and vice versa from a DSP to an aged care pension. We're also always ensuring that the customer's ability, if they're eligible for rent assistance and any other entitlements. We often receive new customers through QCAT that have no pension, have no income. Their pension may have been cancelled due to either not responding to requests for information by Centrelink, and we work to get those Centrelink entitlements reinstated. We often receive customers that have no income and no Centrelink entitlement, and our first priority is to make the application to Human Services Centrelink to get a some sort of income, whether it's a disability pension or an age pension. We have some really good news stories on place, and continually have good news stories in this space. Just recently, one of our customers had no income when we were appointed, and we worked tirelessly to get them onto an age pension and some sort of pension. I think it was an age pension, but the key takeaway from this one is we tirelessly worked. We submitted the application to Centrelink, and initially they wanted more information. Over 6 or 12 months, we continued to provide more information, and the outcome was that the Centrelink rejected the application and didn't think that the person was entitled to the pension. But working with our expert team, with our government benefits staff that are knowledgeable in this, we took the next step to initiate a review through the government, through the Centrelink hearing, and that actually initiated an outcome that we were successful, and the customer was paid back $19,000 in pension. So that is a huge win for just one of our customers, and that's often the situation too when we're appointed, when our customers are in aged care and they're paying the wrong aged care fees, and we review that and we end up relodging the correct financial information, and our customers are back paid the overcharging. So there's always Centrelink and Human Services are really always our priority with our customer, make sure they are receiving the correct benefits. Thanks, Ange.
Thanks, Susan. Some really great success stories there, which is amazing to hear. We'll now I'm going to jump over to our Q&A. So we've got a question from Tim Candy. Can I please get more information on QPT portal? I tried to search portal on your website and there was no relevant results. Yes, this is quite a new service. I think Jay might take this one.
I'll take this, Tim. So it's a good question. The QPT is in a very infancy stage of building a customer portal. So the way we try to do things now is obviously through co-design, testing, validating, and then obviously releasing. The portal itself is available on the internet, and I think it's mainly internet. I'm not quite sure if there's an app as such. I know that there was talk of that. But effectively, it will allow customers to log in, see the most recent payments that were paid either to them or to somebody else. It allows customers to see what the future payments are and when they're likely next to be paid. It shows them what their current asset values are, so both their cash accounts within the QPT, and if they've got valuations for properties or shares, what those things are, just to give them some more information, that autonomy to find out what's going on rather than having to pick up the phone and talk to us. And then the last part of what the portal will offer is an ability to put a request through that comes through to one of our customer relationship systems. If they're wanting to sort of ask for further information, get a statement sent out to them, those sorts of things, they can put a request through. We only have a very small number of customers, so to support that portal, it relies on a new customer relationship management system where only a few number of staff are, because we're also trialing that new system. And we want to make sure that when we do release it to the wider community, that we have the right resourcing there to be able to serve it, so that when people want to contact us through that sort of web form, we've got the staff available to access that information and respond to it, which is part of what's going on with them. And when we talk about our team managed approach and that sort of new model, we need to line up a few of those ducks to be able to serve it. Otherwise, we'd have a portal that customers could see, reach out to us, but we wouldn't be able to serve it. So I'd love to say we could release it out to everybody, but we're still trying to bed it down and fix some bugs and do some enhancements based on customer feedback. So it's probably not as far along advanced as I know some of our customers and support networks and even we would want, but it's about making sure that we can build it based on feedback and understand what customers like, what they use, what they need more information on, and how we can serve that with really quick response times to then start to expand it further. I think there's about between 15 and 20 customers in that sort of pilot phase on our independence program trialing it for us. And I know even as recent as yesterday, one of the directors involved in that project is starting to talk around how do we look to expand, perhaps not to the whole customer base of the QPT's financial administration customers, but how do we make it a much wider expansion to get some more insights and more feedback from customers. So it is moving, but it's just about making sure we have the resources right and that the portal's meeting the needs for customers based on their feedback.
Thanks, Jay. That's great. We've got a question from Jerry John here, and it's got a couple of aspects. So in a scenario where a client has a mild intellectual disability and autism and QCAT has determined that the client has decision-making capacity, the client is experiencing suspected financial abuse by a family friend following the receipt of inheritance money after a relative's passing. The client is afraid to confront the individuals involved or involve QPS. If the client wishes, 1, can they appoint a QPT as a temporary general power of attorney? 2, does QPT assist in setting up a GPA? And 3, will QPT accept the appointment if the client requests it?
I'll jump in here too, and Sue, if I miss anything, feel free to add. I'll work on the pretense, Jerry, that when we talk about general powers of attorney, I'm hoping you're meaning an enduring power of attorney, but if I'm wrong, pop something in the chat and let me know. If QCAT's determined that someone has financial capacity, and they meet the capacity test, obviously that was covered with the OPG around understanding what the document is and all of those sorts of things. Yes, they can make an enduring power of attorney to act immediately, or when someone loses capacity under a certain situation. Yes, they can appoint the QPT, and we can look to accept it. The challenge I think we'd find in the example given is when someone has capacity to manage their finances and it hasn't been rebutted, talking about our conversation earlier this morning, our role as a financial administrator or financial attorney in this case is to act on their instructions. So we would need to be instructed by the person themselves. So if they don't want to confront and they don't want to go to the QPS, they would need to instruct us to do that. And for someone with capacity, whilst we could support them and provide material that the customers instructed us to do, the customer still needs to be involved in it. The other challenge that we would have, particularly if we're looking at a sort of more of a legal framework, is that a customer would need to have sufficient funds, obviously, to fund it and provide instructions as the person starting, and we wouldn't accept that role of a litigation guardian because the person was capable themselves to do it. So it gets a little bit legally technical. What I would think you would find, and what we've experienced in the past when customers have come to us with this type of things, is if we start to engage with some really good advocacy for that person, there's a range of services out there to do that support through advocacy can help a customer do those sorts of things and put things in place. And whilst the QPT can accept the role, in reality, it's quite limited to what we would do. It's not like if we're appointed for somebody who doesn't have capacity, we're the administrator and we're responsible for those decisions. And it's not like if someone appointed us under an enduring power of attorney and they had lost capacity and we needed to act for them. When someone has capacity and they're instructing us, we act on their instructions. So an example of that recently, a couple of years ago now, we had a customer who was blind, fully capable, could understand everything that was going on, but she wanted to sell a house and she didn't want to put that burden on her kids. So she created an enduring power of attorney where we read through the document with her, witnessed those sorts of things, and her instructions were to sell her house. And we came in, we engaged the agent she wanted, we did up all the contracts, she set the price for the house to sell. We negotiated and did all of the documents for her, basically letting her know what was going on. House was sold, money got put into her bank account, we stopped acting for her. We can do those kind of things really simply for somebody. But when we start talking about legal processes for someone with capacity, and it's about their hesitation to do something, well, we're only going to act on the instructions they give us, because that's all we can do. I hope that answers the question.
Thank you, Jay. That's great. We've got a question now for OPG. If OPG is nominated as an enduring power of attorney for health matters, does OPG need to be contacted initially to advise they are nominated? And is the form required to be sent to OPG for Section 5 attorney acceptance for signing first?
Lisa, are you fine? I can jump in if you're, yep.
Yep, you can.
Yep, so we would hope that we would be aware that we were appointed as attorney already on our system, but that doesn't always happen, and that's fine. So yes, definitely still contact OPG to let us know, and then we will request to obtain the document. If we already have a record of that and we're aware, amazing. But if not, then we will go through our processes. Generally, what we do, so part 2 of that question, do we need to sign the attorney acceptance? Yes, but we will only do that in a situation where we're satisfied that the document is most likely valid and the way that it has been executed is appropriate. So if there are any concerns in that matter, the person that's it doesn't actually sit under the investigations team, but my understanding is that the person who is responsible for those documents will make the necessary inquiries about it to understand, for example, if the person had capacity at the time. Cool. Hopefully that answered it.
Thanks, Vanessa. We have 2 questions from Jane, but I believe that they have been answered. So the handover process between different QBT teams, I think that that's already been answered by you, Jay. And then face-to-face meetings, we talked about that as well. So if no one else has any other questions, I just wanted to thank everyone for attending today. Thank our amazing speakers and panelists as well. We couldn't have done it without you. QPT would also like to thank the Council on the Ageing and the Office of the Public Guardian for joining forces with us to deliver such a really engaging and informative session today. The webinar today has been recorded, and I'll distribute that to everyone who's attended via email in the coming weeks. We really hope that this morning's session has been useful and everyone's come away with some great additional information to help you in your daily work and lives. When I send out that email in a couple of weeks, I'll just include a link to a feedback form. We really love being able to deliver these sessions, but would love to get your feedback as well so that we can continue to grow and provide the content that is really useful to everyone on the call today. Thank you, everyone, and have a great Friday.